Now to GMA Health Alert about children and smartphones. A new study released by the American Academy of Pediatrics finds that kids 12 and under who have those devices may be at an increased risk of depression, obesity, and poor sleep. Our chief medical correspondent, Dr. Taryn Narula, is here. This is a pretty big study.
It was, and this is so important. You know, in the first line of the paper, the authors say that smartphone use has essentially become a rite of passage for youth in this country. And as a parent of a 9-year-old and a 13-year-old, I can say that certainly feels like the case. We know that about half of kids already have phones in this country by the age of 11. A lot of parents give their kids phones for safety reasons to be able to communicate with them, but it comes with risk of exposure to bullying, explicit content, and social media. So what do you do as a parent? Do you give your kid a phone or do you not give your kid a phone? And that is what researchers sought to answer. So they essentially looked at about 10,000 kids in 21 sites in the US, and they asked if they had a smartphone and when they got it. They found that the average age was around 11 on average, that kids got phones, as we said before, but that about 64% got a phone by 12. That number jumped up to about 90% by the age of 14. They also found if kids got phones before the age of 12, there was about a 30% increase in the risk of depression, 40% increase in the risk of obesity, and about a 60% increase in insufficient sleep. For each year that they got a phone earlier, there was also about a 9% increase in obesity and about an 8% increase in insufficient sleep. If the kids had not gotten a phone by 12, but then got one by 13, even in that 1 year, they saw an increased risk of obesity and insufficient sleep. So all of this really pointing to the growing body of literature saying that, look, smartphones have potential mental and physical health consequences. And actually, the author of the study said two things which I thought were really good, that when you hand your child a smartphone, you have to think that you are handing them something that may impact their health and make that decision appropriately. And the second is that a child at the age of 12 is very different from a child at the age of 16. Those 4 or 3 years really matter in terms of their development.
So what are the best recommendations?
Listen, I think for every family, George, is different. It depends on the family's values. It depends on the maturity of your kid. I can say in my family, with our 13-year-old, she has a watch because she navigates New York City on her own in terms of the busing system, and we wanted her to be safe, but yet she can't do anything much on the watch. She does have an iPad her grandparents gave her, and that lives in the kitchen. And as we've talked about before, she logs it in and logs it out like a library book, so I know where it is. It doesn't stay in her bedroom at night, and she only uses it for about an hour a day. My 9-year-old has essentially nothing. And so this is a decision our family made. And so really, you know, things you can do that are easy, low-hanging fruit. You can think about things like watches, flip phones, landlines, keep the phones out of the bedroom, put the phones away at meal times or when they're doing homework. Talk to your kids about cyberbullying and social media and friend drama and what they might encounter on the phones. And then make sure they're getting outside and doing organized sports and activity or having in-person play dates with their friends. That's really important. And then lastly, the American Academy of Pediatrics has actually a questionnaire that you can go on the website, and there's 10 questions. I actually did it last night with my 9-year-old that will tell you if you are or your family is ready for a phone. She was ready, but I said no. So.
Good for you to enforce those rules.
But that's the thing, as a parent, you got to stick to it.
It's really hard. It's really hard. And it's hard, you know, both parents have to be on the same page.
And I've had the pleasure of meeting your two daughters. They are delightful. They're engaging. They can have a conversation with you. They're great.
I appreciate it. Thank you.
All right, Doc, thank you for that great advice.